Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls at 866-870-5752 right here in the studio. Again, you can speak with Dr. Darrow by calling 866-870-5752. And right now we're speaking with Bill in Thousand Oaks.
Hey, Bill, Dr. Marc Darrow, how are you today?
I'm doing well. How are you?
Good. I understand you've got arthritis in your thumb. Which hand is it? Your dominant or non-dominant?
It's in both hands, actually.
Oh,
I
okay.
had a series of cortisone injections over the last year and a half, about every 3 to 6 months apart. And I've noticed that my hands are starting to tingle a little bit. So I had a nerve test, and they said I now have carpal tunnel moderate in my dominant right hand, and that's in my left hand. And my
do you work quite a... Well, let me ask a question first. Do you work quite a bit with your hands?
Yes, I do. I'm a handyman.
Oh, boy. I could use your services as long as we can fix your thumbs.
That'd be great.
It's really hard to find a good handyman.
It's true.
And from what I hear, they're booked quite a bit now. The good are.
They're booked forever, and it's really difficult to get a good guy. You sound like a good guy. So we're going to have your number. I'll call you up later. Anyway, the answer to this is you never get cortisone shots for arthritis or pain like that. And the reason is it literally destroys the cartilage, okay? It softens it up. And then as you continue to use the joint more, it destroys more cartilage. So please stay away from that, okay, in the future. How many cortisone shots do you think you've had?
I've had 3, I know for sure.
Okay. And what you hear from doctors, it's okay to get 3 a year. It's not. So back off from that. Use some regenerative medicine using platelets or stem cells. Grow back the cartilage instead of wear it out. And we treat these almost every single day, sometimes several a day. And, whoa, what's going on back there?
We hear noise.
I dropped some tools fell off.
Of course you dropped them because your thumbs hurt.
Actually, I'm holding it with my pinky.
Yep, I get it. Anyway, arthritis in the thumbs or the fingers, pretty much anywhere in the body, can be helped using PRP, platelet-rich plasma, or stem cells. And it may take more than one treatment, so don't get fired up thinking I'm a miracle worker. I'm not. We do see miracles happen. I'm not going to lie about that. But most of the time it's a series of injections, and very simple to use. I'll use like a 30-gauge needle, which is teeny weeny, and we spray it with a cold spray so it doesn't hurt that bad. And the nice thing is you walk in the office, you get your injection, and you walk out.
That sounds great. Can you tell me, does that help at all with carpal tunnel syndrome?
There are ways to help with carpal tunnel. What I do is I use an ultrasound to look inside the carpal tunnel, and that's tendons around the median nerve. The median nerve starts up in the neck, and then it passages around the bicep muscle and comes down into the palm of the hand. It hits the thumb first, second, and half of the third finger, that nerve does. So the tingling usually comes along with some weakness, so we test your strength also and see where you're at with that. PRP is used. You have. Okay, I'm sorry to hear that. So, in the really terrible cases, surgery is needed, but I'd have to check you out and see where you're at with that. We might be able to use some PRP to help heal the nerve.
All right. I've had PRP injections in my elbows, and I was, I guess, one of the miracle ones. One injection and pain went away. It's been gone for over 2 years.
Wonderful.
So I'm a believer in PRP,
wonderful.
that's for sure.
Yeah. I had lateral epicondylitis on both my elbows from weightlifting and hitting too many golf balls on mats. You know, we always say never hit golf balls on mats because there's concrete underneath it. You always want to hit off of grass. But I was over at Rancho Park, and they had mats, and I had nowhere else to go, so I did. And I healed my own elbows back in the day. I haven't had any elbow pain for at least 15 years or more. So I hope yours last also. Good job.
Well, 2 years.
Any other questions?
And I really believe in it.
Good, good.
All right, I think
anything
that's all
else that hurts? All righty. Nothing else hurts on you as a handyman? You'd think you've got neck pain, back pain, and knee pain, and ankle pain, and everything else.
Well, I'm 62, and that means every morning something new wakes up hurting. But it goes away after a day, and I'm fine.
Wonderful.
My hands is what are my issue right now.
Yeah, yeah. Well, God bless you, man, and I would go for the PRP or stem cells, depending how bad the arthritis is in your thumbs.
All right. Thank you very much. Appreciate your help.
God bless.
Have a great day.
Thank you.
Thanks for your call, Bill. Our number is 866-870-5752 right here in the studio. Give us a call. And Francine in Burbank has been waiting.
So, Francine, this is Dr. Marc Darrow, and you are listening to the show about regenerative medicine using platelets from your blood or stem cells, and you've got aches and pains in your legs. What part of your legs?
I can barely hear you. I don't know if it's my connection or yours, but I listen to you all the time. I think you're terrific. And you are one of the miracles that there's a decent doctor that people can get in touch with. And my daughter went to you for knee problems a couple of years ago because I raved about you, and her knee has been great. I think she went back to see you once and had a touch-up or whatever you want to call it, and I agree with what you're doing. And all of a sudden at 83, even though I'm an older person, I've always been active. I've always gone to the gym. I was totally frustrated when we were kept at home because I couldn't go to my gym, and I had a dog that was sick, and I had to take care of the house and cook and everything, and my husband and I are both older and have both been in good shape. But all of a sudden, I started having aches and pains in my legs. First it was my feet, and then I did a few things, and that went away. Then it was my legs, then that went away, and then now I have it in my hands. And I know that it's possible you can have circulatory problems from not exercising, and I could have a problem with platelets or something because the only health issue I've had has been triglycerides. But I don't take medication. The last heart doctor gave me Levelo for the triglycerides, and I took that for a couple of years. It worked, and then all of a sudden is when I started with my aches and pains, and then he said that could be the long-term effect of this Levelo. And so
okay, so let's deal with that right now because I want everybody listening to know this. I get patients every once in a while.
If you think that at 83, with having aches and pains that were in my legs and my legs feeling weaker, and then now I'm having trouble with my hands and my arms, if coming to see you would be worthwhile for you and for me as a patient.
Okay, great questions. Let me address that. I get a patient every once in a while that has that type of a migratory pain who is on Lipitor-type medicines, cholesterol-lowering drugs. And the best way to handle that is to change the diet, get rid of carbohydrates. Francine, you sound really spunky and young. Are you at all overweight?
No, I'm not, because I believe
good.
everything you say about weight and fitness.
Yeah, good. So talk to your doctor, see if you can get off the medicine, and then see if all the pain goes away. That's number one. Number
I am
two,
off all the medicine. I quit that as
good.
soon as I complained, and unfortunately, the pain went away, but then this started, and I know I've never taken medication for high cholesterol except this Levelo that was supposed to help the triglycerides. So that's why I'm sort of wondering. I haven't been taking the Levelo for probably almost 3 months.
Good.
But
I would go to a health food store and get some CoQ10.
Okay.
And take about 200 to 400 milligrams a day, because that may help reverse some of the issues that possibly could have come up from the medicine you took. Okay.
I am taking that.
Okay. Good. Well, I don't know the issue. I would have to touch your body in the area that hurts and see what's going on. Francine, thank you so much. I appreciate your call. God bless you. I'm glad that I was able to help your daughter and her knees. And if you need to come in, the phone number, as you probably know, is 800-300-9300 at the office. We have people by the phones now, or if you leave a number, if they're busy, they'll give you a buzz back. But I would love to see you, Francine, and I hope you heal up. We'll talk about whatever issues are going on and see where the pain is coming from. We always have to find the pain generator. That means, where is the pain coming from? And for those of you folks that want to call me right now, the phone number at the studio is 866-870-5752, 866-870-5752. I would love to talk to you. Nita, anything for you to talk about here, or should I go to some questions?
Well, I just want to remind people that when they call the program today, you get a free book, Dr. Darrow's latest. It's called Stem Cell and Platelet Therapy, and the subtitle is Regenerate, Don't Operate, and it does have 264 scientific studies contained in there, and you can go to the website and see Dr. Darrow performing the treatments on video at www.lastemcells.com. That's www.lastemcells.com. And you can also email Dr. Darrow of every page on the site. So we have a lot for you. But time's running out, so don't wait till the last minute. The number again is 866-870-5752. Right here in the studio, you can call directly with Dr. Darrow. That's all I got.
Cervical stenosis. The next question.
All right.
Cervical means the neck. Stenosis means squeezing. And what it refers to is a syndrome where the openings, what are called foramen, in the neck or the spine anywhere, it could be thoracic or lumbar, it doesn't matter, anywhere from the back of the head all the way down to the buttocks, you can have stenosis. Cervical stenosis deals with the neck, though, and I want to talk about that because there are too many people that have stenosis that are getting surgery that shouldn't be getting it. So the question is there any stem cell or other treatment besides surgery for stenosis of the neck? I have an MRI written report and compact disc which I could send. So none of the images are going to help me decide if I can help you, and I'm going to quiz Nita. What's going to tell me if I can help the person?
When you touch the area.
Exactly. So stenosis as a diagnosis doesn't cause pain.
Now you're a poet.
Okay?
That was good.
The reason is people can be born with stenosis, but it's not squeezing the nerves enough to cause pain. And if they do have pain in the neck, that is not from stenosis. Stenosis in the cervical area or in the legs from the lumbar area comes from a squeezing of the nerves, and the pain will be in the arms or the legs, not in the spine. So that's a key for you right now. If you're having pain in the neck or the back, and you have a diagnosis of stenosis, it's not the stenosis that is the diagnosis of the pain. And what do we do for that? We touch the area. If I can find the tender spots, we can inject them, heal the pain. You still have the stenosis, but it's not the problem. Does that make sense? Probably not.
Actually, it does.
It does to you because you've been listening to me for 20 years.
Well, there's that.
And you had pain in your neck that we healed back in the day with regenerative medicine.
We did.
So you know that this stuff works. Me too. I've had neck pain, and I've had back pain that unfortunately I couldn't reach it myself, or I would have injected it. I have injected my shoulders, my knees, my elbows, my right wrist, but I've had other people do it, other doc buddies of mine do it, because I can't reach back there. Otherwise, I would have done it myself. But get it clear. Don't go to the diagnosis to decide if you have pain. Many people have herniated discs that have no pain. How do we know? We do studies. We do MRIs on people that have no pain at all. What do we find? Stenosis, herniations, all kinds of stuff. So be careful. Do not get surgery for these syndromes. Go to a regenerative medicine doc first before you get surgery and see if you can be healed without a surgery. I see way too many failed back syndromes. That's people that have had the surgery where they come out worse. And don't come to me if you want surgery. I'm going to tell you not to do it. Unless you've got a really badly impinged nerve, your arm is numb, and it's weak. If you've got severe weakness, you may need surgeries, no question about it. But most people don't have that. Most people get these surgeries that shouldn't do it.
Well, we have a few minutes left, so I just want to give the phone number, 866-870-5752. And are you ready for James in L.A.?
I'm living it up, waiting for him. Hey, James, are you living it up today?
Yeah, right. I took a little walk living it up. I just have a question. I was diagnosed with a bulging disc. The MRI showed that it's pinching the nerve, and I had some pain. What's happening? It was going from the leg all the way down to the foot. They prescribed physical therapy, but I haven't done that as yet, and also prescribed gabapentin, which I've been taking for a couple weeks. So I just was wondering, is there anything else I can do outside of the physical therapy?
Sure. Let me ask you a couple questions. Does your low back hurt?
It gets uncomfortable, but it's been doing that for a while. I haven't had the pain shooting down to the foot since I've been taking the medication, but I don't want to continue this very long. Obviously the medication.
So the main thing that we could help you with is the low back pain. And sometimes when we fix that, then the leg pain goes away, because there are what we call trigger points in the low back that can refer down the leg. I've had that before myself. And the most spectacular trigger point that I ever experienced in my practice was a man who had terrible headaches for years and years and years. And he came in the office with his wife, and I said, "Do you mind if I touch your neck and your back?" And he goes, "Yeah, that's fine, but why would you do that?" And I said, "I'm looking for spots that can refer into the head." So I found a spot on what's called the levator scapula attachment, and that is an enthesopathy to the scapula. And he screamed, and he said, "Don't touch that. That reproduces my headache, which feels like a hot poker in my right eye." And I said, "Do you mind if I just inject that area and see if we can get rid of that?" And he was like, "Well, I don't want the pain in my eye. Will it hurt that?" And I said, "I don't think so. I think it may get rid of it." So I injected that, what I'm going to call trigger point, on his enthesopathy, the levator scapula attachment to the scapula. And he stood up with a big smile on his face, and he said, "My headache is gone." I followed up with him for several months, and he no longer had headaches. So I'm not telling you that's what's going on, but I do get a lot of people that have these enthesopathies. Enthesis is where the tendons, ligaments, muscles attach to bone. And when we fix that using platelets or stem cells, then the pain that's radiating, so to speak, sometimes goes away. And that may be the case in your leg. So what I would do is I would attempt to fix the low back pain, which we do in most cases, and then see if the radiation down the leg goes away. Now I have to tell you this. Bulging discs don't generally cause pain. Most people, as they age, have bulging discs, and they don't have pain. So don't get sucked into or seduced into the thought of having a surgery for that, please.
No. The only thing, maybe an epidural shot, they were saying, would possibly help. But, I've known people it has helped and other people it hasn't. So,
the epidural is going to help in the wrong way. An epidural is a giant amount of a steroid shot. And I don't care if you stick it in the back or in someone's toe, they're going to get pain relief all over the body. Do you understand that?
Yes.
So that's not the place.
Term.
Generally not, because
relief is not. Yeah.
Yeah, generally not.
It's a short-term solution.
Yeah, I mean, if you have low back pain, I'm not going to give you an epidural.
Right.
I'm going to fix the area and get rid of the back pain. I'm not saying epidurals are terrible, but there's a lot of people that they don't work very well for, and they cause terrible problems for at the same time. So we have to be careful and make sure.
I had a situation, and also in my arm, shoulder area, and I saw you on the golf course, and you went and you put a pressure point on exactly where it was, and you diagnosed it instantly. So, I have faith in you. So.
Well, thank you. I appreciate that, James. You want to meet me on the course later today?
I will. Will you play north-south?
I'm playing at 436. I think it's from the north, and there's one spot open. You'll see my name on the computer.
It's tough to get a tee time now, that's for sure.
Well, there's openings in late afternoon. Anyway, God bless you, James. I'm glad you mentioned that we met. And
all right.
Come on in. Let me fix you up.
Thank you, James. Appreciate your call.
Thank you. All right.
Okay, our number is 866.
Well, that's wild.
That is very fast. Small world, I'm telling you. It is a small world. 866-870-5752 here in the studios. A few minutes left to speak with Dr. Darrow. And remember to check out the website at www.lastemcells.com. And we are out of time. Thank you, Dr. Darrow.
Thank you, Nita.
You're welcome.
God bless you all.
And thank you, Alex. Thank you, Suzette, and everybody who listened and participated. And remember to listen to The Pet Show with our pal Warren Eckstein from 11 to 1 every Saturday. I'm your host, Nita Valens, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.